Hello, everyone, and wherever you are in the world right now, thank you for joining us today. I'm Dr. Andrew Sharman, President of IOSH, and I'd like to welcome you to the latest in our series of COVID-19 webinars. As you know, IOSH, the Institution of Occupational Safety and Health, is the chartered body and the world's largest membership organization for health and safety professionals, with over 47,000 members in 130 countries, working in nearly every sector of industry. Our vision is a safer, healthier world of work for everyone. You know, we began these free weekly COVID-19 webinars at the start of April, and today's our 21st in the series. It's quite incredible. You can find access to all of those previous ones and resources too on the IOSH.com website. On behalf of IOSH, I'd like to extend a thank you to the Financial Services Group for supporting the creation of this session and assembling the fantastic panel with us for this hour today. This pandemic is, of course, having huge impacts, not only on people and workplaces now, but also the future for us all. There are serious questions and concerns hanging over us, in particular related to health and well-being, societies and economies, leadership, mental health, incident management, workplace design, sustainability, and simply the future of the workplace or office as we know it. These are the upfront costs of COVID-19. Many more remain untold, but there'll also be benefits, and it resides with us to identify and to realize these benefits for the common good. In the midst of all of this uncertainty, we must now regain our focus to understand the challenges we face together. The world of work as we once knew it is history. It falls to us to develop and implement suitable strategies that secures the safe, healthy, and productive future of work and workplaces. So to help with this today, I have a fantastic panel of 5 individuals who'll debate these very issues, giving their valuable insights and advice on what they believe the future might hold for us. So I'd like to start by welcoming Lisa Bartlett, UK and Ireland President of Crawford and Company. Lisa has worked in both the insurance and broking sectors in a variety of senior management roles, gaining a deep understanding and experience of the claims sector. She has a proven track record of developing new and existing business, implementing sales and retention strategies, and leading major cultural change programs. Welcome, Lisa. Please go ahead and start your video now. Next, we have Steve Collinson, Head of People at Zurich. Steve has been with Zurich for over 30 years in a career which has seen him drive and deliver major initiatives within HR, communications, finance, and various customer operations in both customer-facing and business-facing senior roles. Steve works alongside the UK executive team, shaping the employee value proposition and engagement initiatives to deliver Zurich's goal of being a great place to work. He has a particular focus on building diversity and brings leadership, passion, and deep business experience to his role. Welcome to you, Steve. Please join Lisa by starting your video. And now welcome Nigel Sullivan, Chief People Officer at BUPA. Nigel's 30-year career started in human resources at Rover Group, and he has held senior HR positions at Nortel Networks, Marconi, and Wincanton PLC. He was awarded Chief Human Resource Officers of the Year, EMEA, in 2016. And was included in HR Magazine's most influential list of 2019. Welcome to you, Nigel. Start your video, please. Finally, 2 people who I know very well indeed. Tim Eldridge, Global Head of Health and Safety, and as a Vice President of IOSH, a fellow member of my presidential team. Tim has significant experience with health and safety regulators, not only as a former inspector for the HSE here in the UK, but also with OHS regulators in South Australia and Queensland too. In addition, Tim has delivered sustainable health and safety performance and culture change, transforming team performance and leading physical security, business continuity, incident management, and third-party risk functions. Tim, go ahead and start your video, please. And we're also privileged to have with us today Bev Messenger, Chief Executive of IOSH. Bev's an award-winning leader with an extensive experience in human resources and operational and strategic leadership too. An HROD professional by background, Bev's a fellow of the CIPD, that's the Chartered Institute of Personnel and Development, and has focused in the last decade on major organizational transformation, in local and central government. Welcome to you, Bev. Please join us now. And audience, please welcome your panel of 5. So look, although the Q&A box is available for you to ask questions, we'll be focusing mainly on a fixed line of questioning in this session. Don't worry though, because anything you ask today through the Q&A service will be reviewed following the webinar and posted on the Financial Services Group microsite on the IOSH website. And we'll give you the link for that in the chat box shortly. So I'm going to jump straight in with questions now for the panel. And I'd like to start in the order in which I introduced you. So let's come to you first, Lisa, please. Lisa, health and safety is currently at the forefront of business strategy, isn't it? Thanks to the pandemic. How do we keep it there?
Well, it's a personal view, but one of the things that I think is good that has come from the pandemic is the focus on health and safety. I think that the new normal is going to be with us for quite some considerable time. So I think we're going to keep the focus automatically. I don't think there's too much we need to do. And it's certainly my hope that the focus on well-being is a permanent feature.
Got it. Steve, what are your thoughts? What can you add for us here? Steve, I think you're on mute still.
My apologies. I agree entirely with Lisa, actually, but I think there are a couple of things. I think it's really important that we capitalise on the engagement we've had with senior leadership. So if I think about my organisation, our executive team are more focused than they've ever been on the safety, of course, but of well-being, as Lisa mentioned too. So I just think it's really important that we don't lose momentum. We don't allow things to slide so that safety and health become one of those things that are in the background, looked after by your health and safety team. And then I think one of the reasons why it's engaged people far more is we've been far more human about health and safety and well-being through the pandemic. We've made our messaging, I believe, much more relevant to individuals. And I think it's really important that we keep doing exactly that too.
Thanks, Steve. Nigel, what's your perspective here as Chief People Officer at BUPA?
I think for us, I mean, health and safety is pretty high on the agenda, being a healthcare company, you know, with people who work in clinical environments and, you know, with that be in aged care, hospitals, etc. So it's kind of it's a privilege really to be able to, you know, I've worked in other places where I've had to push it a lot further up the agenda. You know, it's been harder to get there, but that's a good thing. But I think the thing now is the two things I've really noticed are people really taking their own health and well-being much more seriously, and I think there's an opportunity as a result of that to align, if you like, traditional health and safety with health and well-being much more, and bring the two things closer together, so that we can create workforces or workplaces that are physically and psychologically safe for people. So I think that's kind of I think it's an opportunity.
Thanks, Nigel. I think you're right to contextualise that by saying you are a healthcare company, so naturally you would expect you to have a bias towards that. Tim, you're not in a healthcare company. You're global head of safety and health for one of the world's biggest banking corporations. Is what Nigel and Steve are saying resonant with you? Are you starting to broaden out that context into health and well-being more generally?
I think absolutely. I think, you know, all of us probably would have had a focus on that pre-pandemic, but I think what's really struck me, certainly working in the financial services sector, which, you know, isn't renowned for being a high-risk industry, although, for example, HSBC have 250,000 employees around the world. It's sort of high-density, low-risk type of focus. And there's two things that struck me. One is that, you know, people didn't really know who to go to. And so having the team step up and say, actually, hello, we're here, we can help, has been quite an interesting, albeit challenging thing to do. But I'm glad that the team have done that and put their head above the parapet, because that's what we do as health and safety professionals. The second thing we've got to be really careful about is we don't overstep the mark, and so start to give advice on things that perhaps a little bit outside of our subject matter expertise. And clearly with the pandemic, I mean, the virus itself has been an evolving and changing thing. I might talk a little bit more about the challenges of changing your advice in the midstream, but just knowing where the limits are and going to more expert advice when you need it.
Bev Messenger, as CEO of IOSH, I guess Tim's words resonate with you, that importance of knowing where the boundaries are and not overstepping the mark, but also perhaps Tim's earlier comment about at the beginning of this, organisations didn't know who to go to. I guess the answer to that question is IOSH, isn't it?
Well, yes, of course it's IOSH, and I suppose what I want to say is how immensely proud I am of the profession, whether people are in IOSH members or they are more on the periphery of occupational health and safety. This has really been our moment, and it sounds terrible, doesn't it, when you're in the middle of a pandemic where there's been huge tragic loss of life, but it has been amazing the way individuals, teams, organisations, and actually this institution, I think, has really stepped up to the plate and said, this is our moment to demonstrate how critical we are, not only to workforce health and safety, but actually societal health and safety, that awareness raising of people's own personal health and well-being, but also within the context of, of employment, I think has been really amazing. And we've tried to add value to the profession by giving as much information, tools, techniques, advice, guidance, webinars. We've really been full throttle on trying to support each and individual health and safety profession to demonstrate how central they are to business now, but also keep that foothold going forward, because I do think there has been a societal change and there has been a business and employment and government change in how health and safety has been perceived. And I hope once and for all the bonkers falls by the wayside and we are seen as, really central to health, safety, well-being and business continuity, sustainability and profitability. I think we've got a massive role to play now in, recovery work and getting business back on its feet.
You're taking me to where I thought might be important for this call, particularly given that this is representing the financial sector predominantly here. So let's think about business here for a moment. It's long been said that good health and safety equals good business. However, over the last few months, we've seen a lot of home working going on. And in fact, we're seeing research by IOSH and others showing that home working doesn't really appear to have affected productivity for workers. And is being viewed as successful. In fact, I'm looking at the report in front of me from the Institute of Leadership and Management saying only 1 in 3 workers expect to return to the workplace. They think home working is here to stay. But what are the longer term risks and impacts we're facing if home working becomes permanent for the majority of workers in a workplace? Tim, any thoughts on that?
I might start by just turning it around a little bit and saying I think the benefits absolutely outweigh the risks. Of course, there are risks, and we'll talk a little bit about those. But the benefits of flex, and I call it flexible workforce. So it's not about either working from home 5 days a week or working in the office 5 days a week. It's having that flexibility to do both. And I think the benefits of that. And we've had 220,000 employees working from home, I think, at one point. And you're right, without any significant, well, in fact, increases in many aspects of productivity. But of course there are risks, and that's what the question was about. And I think those have been surfaced quite a lot around employee well-being, and as well as employees who have some more challenging home environments. So they've got many of our employees who work in Asia who live in a home with multi-generational families, so 3 or 4 generations of their family in quite cramped living conditions. So working from home is not as easy for them as perhaps we who may be a bit more privileged to have the space and the time and the quiet to do that. So that's absolutely a risk, and I'm sure the others will talk to that as well as of course the ergonomics and how we develop a safe and ergonomically sound home working environment as well as an office or branch working environment.
Let's see if I can get Nigel Sullivan, Chief People Officer at BUPA, in here on this. So Nigel, talking about this from a health perspective, what are the longer term risks and impacts that we face if home working becomes permanent?
Yeah, well, we were talking about, some of us were talking before the call started. So I personally think I think clearly there has been a shift, no question about it. But I think just certainly in our case, we have to cater for people who are working in care homes, people who are working in contact centres, people who are working in offices. So we have to find a way of providing, safe workplaces for people wherever they may be, whether that be at home or not. But I do think it's been a shift. I think it's a little bit early to call some of it. but I I believe that certainly for office space, we will probably get into bit like it's just been said by Tim. I think it'll be more of a hybrid sort of environment. People will do part office, part offices. Offices will probably come more about collaboration than a physical a physical place where you do your work and your output very often. I think we're going to see those sort of changes. We don't really know the long-term effects, and we benefit from we've got obviously a large clinical team, and I hadn't realised this. Things like PTSD. I'm not a clinician, but that can take 6 months to show up, and the person doesn't know that it's going to show up, in 6 months' time. So I think we need to keep an eye on this, keep an eye on the ergonomics, keep an eye on the mental health stuff, and support people as best we can. And we had a fairly flexible office environment globally anyway. And we called it fresh working, but we've changed it now. We call it fresh working from anywhere, to try and cater for that. But I'm cautiously optimistic, but I do want to keep an eye on it.
Steve, you're working in a massive insurance organisation. What's your take on this? Are there some key risks that you've already started identifying in your organisation if home working becomes permanent for a majority of people?
Yeah, there are, and I'll just touch very quickly on productivity and then risk. So when we talk to our employees, like most people, we've surveyed employees in this period about their experience. 2/3 of them told us they were as productive or more productive than when they were in the office, and over half of them said more productive. So, and you can see that through our data. A number of our claims teams in the first weeks of lockdown had their most productive days ever. By quite some degree. That's settled to a degree, of course, since, but productivity hasn't been a challenge for us. But then in terms of risk, I think there's a commercial risk. So ours is a largely relationship business, and people driven, but a relationship business. And doing business when you are able to do business remotely, like we're talking now, when you're able to rely on long existing relationships, is pretty sound. But as you need to start building new relationships, as relationships change, as people move around organizations, there is a definite commercial about how you keep as focused on your customers and as important in their minds when you don't see them in the same way. That the business over lunch days are long gone. And then from an individual perspective, there are a number of things. Nigel, I think you're absolutely right to flag the potential for post-traumatic stress. I was talking to a psychologist last week who was saying exactly the same thing, and that in scenarios around the world there have been, the 6-month gap is one for us all to be absolutely aware of, and is not too far around the corner for us. But then also, the more people work from home, the two key risks that I think we face are isolation, which is hard to talk about. It's hard to say I'm lonely. It requires a leap of faith to say I'm lonely and struggling. So isolation is a worry for me. And then the ability for people to switch off. Our people have told us that of all the things they found most challenging through lockdown, at least when they had a commute, most of our people were office-based, at least when they had a commute, there was a finite end to the day. And that isn't the case. The laptop's in the corner of the kitchen, buzzing away at them, pinging with new messages. So isolation and the ability for our people to reclaim their their personal lives is really crucial.
This idea of isolation really resonates with me, Steve. It's I'm sitting in my office in Switzerland. I'm the only one in here today. It's 2:00 in the afternoon. I've now been in the office for 8 hours. And for all of those 8 hours, I've moved from one Zoom call to another, to another, to another, to another. And I got to tell you, I am feeling a bit lonely. This is a highlight of my day that someone acknowledges that and gets us thinking that, this is very real for many of us. And these are some of the real risks that we face, I think, not just in the 6 months that's gone by, but the next 6 months too, as still we continue these disrupted ways of working, whether it's in isolation or in hot desking arrangements or any other connotation that work environments are coming up with.
I'm going to try and find some colleagues from down the road in our home office to come and say hello and grüezi.
Thanks, Steve. I appreciate that. Get them to bring some Rushdie or something with them too, would you? Let's kind of stick with this idea of virtual meeting technology, because I wonder if there's a benefit to it too. I wonder perhaps whether virtual meeting technology allows us to look for more talent in different places. Instead of, when we're recruiting for a role, instead of looking at advertising in our local newspapers or national newspapers, now the world suddenly becomes completely open. If we acknowledge that home working's here to stay and virtual meeting connectivity works as well as being in the same room. So I wonder what this means for tackling health and safety risks that span many jurisdictions. If suddenly we've gone from a local organisation to becoming very quickly a multinational organisation with people in different places around the world. What does the panel think about this? I'll just leave it as a kind of hanging question and see who wants to jump in. Where are the health and safety risks with a workforce that spans many jurisdictions?
Go on, I'll jump in then.
That was a tough one, Tim, wasn't it? Thanks for picking up on that.
It was, you know, I mean, I suppose the point is it's not new for my organisation. You know, we've got people in 60 different countries in 4 different regions around the world, and therefore being able to recruit the right people in the right place at the right time, you actually take out that right place bit. It's the right people at the right time, and I think what's probably been the better thing for me from the pandemic is not the fact that we've always been trying to do that, is that perhaps certain parts of the organization who are more traditional in their ways of thinking around seeing is believing, and you know, being in the office, presenteeism is important. That's just been absolutely hand grenaded out of the ball game, because they've just seen that productivity. Now, I'm not saying that's gone, and there will still be those people who think that way, but now we've got the evidence to support it. So if you're ever challenged about recruiting a health and safety manager from Pune, for example, in India, to support the global team, and I've got all of the evidence I need to say that can work.
One of the things that we've noticed, and this is a relatively minor point, but it's just an interesting sort of little point, I think, case study, is that, you know, we have a lot of people who work in contact center environments, you know, and you're dealing with people's health claims and stuff like that. So it's quite, you know, it has to be a safe place that customers can go to talk about, you know, whatever it is they need to talk about to somebody and get the right cover and all the rest of it. And of course, that's all been virtual, you know, and the access. Whereas in the past we've thought of, you know, that needs to be, if just UK, that needs to be in Brighton, you know, that needs to be in Staines, or that needs to be in Salford. Now it's like, it could be anywhere, you know. So the access to talent for something like, you know, just that as an example, is no boundary to it really anymore. You know, that's one of the things that technology is going to give us. Yeah. So
let's bring Lisa Bartlett in here. Lisa, do you foresee then that the future workforce will be lying on a beach in the Bahamas or somewhere nice like that with a laptop in front of them and a glass of something cold?
Not so much. I mean, I have the benefit of already working for a global company, so we do kind of source talent in lots of different jurisdictions. So I think it might accelerate kind of the development of technology integration and also offshoring, but I'm not seeing a wholesale move. I do, however, see some benefits in terms of social mobility in the UK, where new roles will get created in other centres outside of London. So I do think there'll be benefits. And you know, I think we're all really lucky, well, to be based in the UK, because I think in terms of managing health and safety, the UK standard is a pretty good place to start.
Okay. I'm looking at a flood of questions that are coming in from the audience. And whilst we suggested that we're going to try and stick to the questions that I've got written down that I want to try and focus on, I can't resist this one coming from Stephen Moyer. Bev, I'm going to put you on the spot with it. Stephen Moyer asks, isn't high productivity from working from home driven actually by the employee thinking that their employer doesn't trust them? That's why they work so hard.
I mean, I'm sure there are people who feel like that, and I've shared with my, you know, my team at IOSH. I can certainly remember years ago when I first started to work from home, and I felt like I had to be always on. You know, I would take my BlackBerry to every room, you know, even the smallest room in the house, because I thought my boss would need to know that I was always available, even though I was working from home. And of course, you know, that's gone by the board now. You know, it's interesting that a lot of the questions or a lot of the comments we've been talking about, for me, start with organisational culture. So if you have an organisational culture which is based on openness, transparency, engagement, you know, organisations that trust each other, managers who are really skillful in their people management activity, then some of those, you know, preconceptions about, you know, presenteeism do tend to drift away. I mean, I've been thinking a lot about my own leadership style through this, has had to change. And we definitely, as we move into whatever our new operating model is going to look like, and it is going to be more people working at home, you can't just lift normal management techniques in an office environment into a virtual environment. So we are going to need to put a lot of leadership management and OD capacity into retraining and rethinking some of our managers to work in this way, to ensure that people are well supported, but they're managing outcomes and performance in a different way. You know, it's very different when, you know, if you've got productivity where you're measuring widgets, you've either created the widget or you haven't. But, you know, lots of the things that we do, projects that we deliver, you know, all sorts of activities that people are engaged in, don't have those hard metrics. So it is about being really skillful managers, measuring outcomes, and, you know, worrying less about, you know, are people productive through every minute of the working day? You know, like everybody, we've got what we call smarter working. And it's also not about necessarily where you work, it's also about the hours you work. I don't mind if people want to knock off at 3 o'clock, pick the kids up, walk the dog, do whatever, log back on at 7, do a bit, then, you know, we give people that degree of flexibility because we trust our people, that they know they've got deadlines to meet, things to deliver, and that they will do that, or they will negotiate something different with their manager. So I don't think we should underestimate that, you know, for me, the heart of all of this and the success of IOSH's transition to remote working through COVID has been from a really, really strong culture, values and behaviours about what we expect of each other, and that we trust each other and we treat each other as adults. And, you know, I think that is, it's much more upstream about managing the risks. If you've got that right in the first instance, a lot of these issues that we're tackling or challenges do actually sort of fade away.
So we've presented so far, I think, an argument for and against home working, in that it may be good for productivity, it may be bad for people's mental health as they feel isolated or disconnected. Neil Catton on the Q&A box is stringing together a couple of these points. And I want to get Nigel Sullivan's take on this as Chief HR Officer at BUPA. Neil says, don't we feel there's a really important aspect regarding social interaction and teamwork building by getting together and bouncing ideas around on flip charts in rooms? Or am I the only one that thinks this is really powerful and too much distance is sterile? So what's your take on that, Nigel, as an HR leader?
Yeah, no, well, you're probably getting more of a personal view on this one. Andrew, I mean, I agree with the colleague on the. I mean, I actually went into the office, our head office in London last week. Myself, I live many miles away from London in terms of family home, and it was great. Even though there weren't that many people in, it was great to see people physically, even though we were all socially distanced and stuff like that. So yeah, I do. You know, my suspicion, I think I sort of mentioned this earlier, my suspicion is that, you know, I mean, we're talking about office environments. That's obviously not the only work environment for humanity, but there's lots of others, you know, that don't have that choice to be able to do these things. But I think where offices will come into their own, I think will be, you know, this collaboration space. You know, I think it'll be, I think there'll be a redesign, and I think that we will find ways, because we always do as Homo sapiens, find ways of adapting to create that, because it is quite hard to do on the current technology, even though there are ways of doing as we know, there's ways of doing breakouts, and you can raise your hand and virtual flip charts, but it's a bit clunky compared to the reality of human interaction, I think. But that's a kind of personal view, because not everybody would agree with me on that, but I think a physical interaction does help a lot, and I think it counteracts some of the other things as well. I certainly felt being in the office last week, and then was a great settler for me, and then, you know, being at home this week and kind of doing every other week was a refreshing thing as well. Just, you know, variety's the spice of life, isn't it, as well?
Let me come back in there then, because I've made the mistake of taking questions from the audience, which has now opened the floodgates. So I'm going to add a little bit more pressure to your shoulders, panelists, if I may. and ask you to be as concise as you can so I can get more panelists talking on each question. A question here.
Andrew, can I just come in on Neil's point?
You can, Bev, but let me get my question out first.
Okay.
Nigel's pointing towards this fact that the traditional office as we know it is going to change, but he's also highlighting that there's this need for people to feel connected or to feel space. And I'm just wondering, what does it look like for the future? What is it that you, the panel of esteemed leaders, think we're going back into in the new brave new world? Do you want to kick us off with that one, Bev?
Well, I suppose I was just coming in on the one about, you know, flip charts and whiteboards and all the rest of it. I think some of that is generational. You know, I am missing that. I'm missing my whiteboard. I'm missing my team meetings. I'm missing my office. I'm missing all those things that I have, as a, you know, woman of a certain age, have grown up with. But it's a bit like I still use the telephone and I don't text people constantly. My stepdaughter, 25, wouldn't dream of phoning somebody and actually speaking to them and having a conversation. Why do you need to do that, Mum? I can WhatsApp them. So I think there is definitely going to be a change in the way the office environment works, and it will be perhaps harder for me to adapt to that. Whereas the next generation coming through just communicate and interact in a very different way. I'm not saying they don't want social connection, because they absolutely do, but they are used to doing it in a more virtual environment. So they just get that connection through different means. So I think that does shape what the office of the future will look like.
Yeah, Andrew, I would just add that, you know, we're kind of kicking around a hypothesis that we call workplaces as social spaces. This is it very much talking about what Nigel was talking about, you know, is the office of the future far less about rows of desks and far more about collaborative spaces with really good technology and fantastic facilities. And, you know, maybe we return to the days of free breakfast and great coffee, that people can come together, teams or groups of people. If you're bringing agile groups of people together, they can come together in a physical environment, but then they return to their non-office environment for their day-to-day tasks. So team space is the idea we're kicking on.
I've been waiting for you to say something like that, Steve, because you always agree with me when we talk. And now I'm going to challenge this a little bit, as really through the words of Joanne Price and Rob Fitzmaurice, who are saying, hey, okay, panel, but you all work for really large organizations with loads of money and loads of space to do all of this. Well, what about smaller companies that are already working lean and might not have the same access to technology? This may not work, some of this sort of stuff that you're talking about. Social workplaces, fantastic. Free coffee, fancy breakfasts, lovely. What if you're an SME? What guidance does this panel have for the smaller businesses?
Oh, we are an SME. So although we're a global organisation, you know, there are less than 200 people in IOSH, as you well know, Andrew. And we've been able to do huge amounts at not great cost, because we're a charity and we, you know, really watch every penny. So there has to be an investment in technology, because any SME or any small business that doesn't invest in technology is doomed. But you have to spend that money wisely. But you'll also have to just be creative in the space that you've got. So you don't need flash Google style offices to create some of the environments that we're talking about. For me, it still comes back to the culture and have you got the mindset within your organisation to operate in a different way. Walls are walls, and you can make adaptations to that without huge amounts of cost. I think it's more about, have you got the mindset, the culture right to work in a new collaborative and innovative way, and actually that can be at quite low cost.
So this idea of mindset and culture is important, isn't it? I guess many organisations have undertaken staff surveys during the crisis, and if any of you in the panel have done that, well, I wonder if you could share what sort of positives have come up. And are there common concerns that you've identified through these sorts of surveys as people return to the office?
We've had an overwhelmingly positive response. You know, as you issue a survey, you never quite know what the results are going to come back, but ours was overwhelmingly positive. So I was absolutely proud. Probably the single thing that stood up for me was kind of how much our managers had stepped up. And I think our managers are critical to success or not in this environment. But there were common concerns. I think as we see the schools in the UK are restarting, homeschooling as on top of home working, certainly I've enjoyed that challenge through the lockdown period. that has presented a huge challenge, and I don't think you can underestimate that for all of those working parents out there. There's a real nervousness, I think we touched on that earlier, around the use of public transport. I think that will be with us for some time to come. An evolving feature for us is kind of, we've made, you know, a restricted number of offices available. And, you know, there was huge demand initially, but now there's, okay, so who's going back and how is that going to work and how do you make that practicable? The biggest thing for me, though, is our people have got used to having a work-life balance or more of a work-life balance, and they want to keep that. And I think that's a hugely positive thing. So again, I'm going to need my managers to be mature enough to kind of make the right decisions and take the positives from the pandemic.
And Lisa, I would agree. Our employees told us that on average, they're saving 56 minutes a day commuting time. That's not to be sniffed at, and that's average. Of course, there's plenty below, but there will be lots more who are much more extreme than that. And for me, it's individual stories that are important. So we've been reacting, of course, as an organisation to the difficult stories. We've been helping out people who are balancing their laptop on their knee, doing all of the stuff that all of my colleagues, I'm sure, are doing. But then we do hear great stories. I was talking to a working parent a couple of days ago who said, in lockdown, I've eaten dinner with my children pretty much every day. I can't remember Monday to Friday the last time I did that. You know, and dinners and meal times with small children would be stressful events. And I sit and eat dinner with my kids. You can't put a price on.
One of the words of, sorry, Andrew,
go ahead.
Just one, you know, we talked about new words that are coming up this year that we perhaps hadn't used before, and of course for those in the UK and perhaps other countries, the word furlough comes to mind. And for those who aren't familiar with that word, that's where an organisation has to ask an employee to stop working, but that their wages are still covered by some government scheme. So you've got a lot of people, and certainly my organisation has been affected by this, who are actually sitting at home not working. And the risk about that, we've not really thought about, well, we've not been in that situation before. So as part of the survey, one of the things that came across very, very clearly from the furloughed community is that you need to keep in touch with us regularly. We need to know what's happening. We need to know what the plans are, and do not just leave us hanging and bring us back in October or whenever it comes. So I think that's an important point to make.
Tim, you must have been reading my mind. I was looking at some questions that are coming from Pete Charlesworth, reminding us that, remember, there's lots of jobs that can't be done from home, like healthcare or training or manufacturing. And then he goes on to say, I'd imagine that all members of the panel are senior or very senior management. So what's the evidence from the coalface that home working is really working for frontline employees? And Tim, perhaps you're suggesting that maybe this is around increased communication, but it's not, I think, about more emails and more memos being sent. There's something more human that's needed here, isn't there, for these frontline workers?
One of the things I actually found the most interesting is when I spoke to people and surveying them about that, when they see their senior leaders working from home as well. And you can't get away from that. They actually feel it's okay. But if they're obviously, you know, they're engaging from home to senior leaders in the office, that culture, the organizational culture that Bev talked about, that becomes skewed. So yeah, that was some interesting feedback on that.
We've obviously got people in those frontline jobs, you know, in care homes, hospitals, clinics, dental practices, and that's been I think a different challenge. It's obviously you've got the challenge of communicating with people, but making sure they're physically safe as well, you know, through, you know, providing the best PPE that we can, etc. That's really been very important, that they feel that way, supported, you know, because they can work from home, most of them.
Yeah, Nigel, we also have an engineering workforce of about 600 people who have continued. You know, the only day that they haven't been out on the road with customers was the day after the government's announcement, where we just said pause and let's get our head around it. The day after, they were back in schools, food manufacturing facilities, hospitals. They carry out statutory inspections. And keeping them safe has been, as you, in the same way as for your workforce, a real challenge, very different to your office-based organisation. But as well as running our kind of informal survey, we ran our twice yearly employee engagement monitoring survey 6 weeks ago. And that workforce, our whole workforce actually, recorded its highest ever levels of employee engagement, including that frontline workforce. So I think it gave us reassurance that we'd got some stuff right through the process.
Steve, let me see if I can connect a couple of points that I've heard each of you make with a couple of questions that have come in, as well as something that I wanted to kind of explore a bit. This idea that lines between work and home have been blurred or even vanished for many people. And I wonder, how do you make sure your people maintain the balance between work and family? It's great to hear, Steve, that one of your colleagues has had supper with his kids every day of the week. That's fantastic. But what about those people that are working into the night because they feel the pressure from a multinational society that's operating at different times? We've all become addicted to our mobile devices, and we know that we love that feeling of answering an email when we see it pop up, or a new WhatsApp message coming in or whatever. Allied to that point, before you answer it, I want to just mix it a little bit with a question from Martin Coppard, who's saying that Martin's concerned about the ability of younger workers to develop the interpersonal skills that enable them to articulate themselves, influence, negotiate, and so on. And being in an office amongst people every day plays a big part in developing those sorts of skills. Martin's worried about the long-term consequences in terms of our future workers' ability to work with others and communicate effectively, not just in terms of this isolation from the office, but also perhaps with regard to this blurring of lines between home and work. What does the panel think about this?
I think that is a brilliant challenge from Martin. That is something I am really struggling with right now. So there's a talent shortage within my industry. So the development of talent for those early career roles is crucial. So I don't have the answer yet. So I'm thinking about apprenticeships and graduates. So how do I equip those when we are 100% home working? So that's something we haven't got the answers yet, but you know, we've just started the thinking about how to do that. That is going to be key, absolutely key.
Yeah, I would add on the behavioural skills. Actually, it's something that for a number of years we, as an organisation, we haven't actually invested in. We've diverted our resource from a learning and development perspective into other skills. From this point on, actually, we've culled about half of our learning and development offering and are moving about 50% of our budget, which includes, you know, a chunk of employers' apprentice levy, back to soft skills, because we recognise and our people are telling us that they're missing out on opportunities and experiences, and we don't want them to miss out on them in the long term.
Mm-hmm. We're starting to get back towards the importance of business in this discussion on occupational safety and health, and there's a couple of fascinating questions that link into this idea of environmental sustainability gains around reduced transport emissions, reduced energy consumption, and so on, as people are less in their office. But as Mark Burkett and Linda Ramirez point out, both of them almost exactly the same question: is there going to be some closure of offices, which of course is having some positive environmental sustainability impact? And if there is, what's the negative side to that? Will it have a significant impact on town centres, business parks, societies, the small shop on the corner near to the office where we get our cups of coffee in the morning? You know, isn't there a balance between supporting this new way of working and also boosting the economy? Are we stuck between a rock and a hard place here?
I think we are. I think we are. I think it's a really tough one. I was in, as I said, I was in the office last week, and we were in the city near the Bank of England, and it was like a Sunday morning at midday on a Wednesday. It was like a Sunday morning. Very few people around. Most of the coffee shops shut. And I think the central business districts around the world are really going to struggle for some time to come. And I think I suspect, you know, somebody mentioned SMEs, and all, you know, I think it will be property will go from, you know, being scarce in some of these CBDs to being a surplus. Prices will drop, and I think we're going to see big change unless we get a vaccine, you know, in the next 12 months or whatever. I think we're going to see big changes, really big changes. Not for the better, I'm afraid, economically. Yeah.
You know, I don't want us to spiral into a black spot here, Nigel, but you're perhaps pointing towards the importance of this not all being sunshine and roses. Whilst home working may suit some people, whilst a phased return to work may suit others, and we all might find some kind of positives amongst this pandemic, there are some really serious challenges around here. So let's shift the gear and turn into thinking about how we support people's mental health during the crisis. Because I can tell you at the start of this, Bev and Tim know this very well, at the start of this pandemic, I started to panic, thinking I'm going to be the first president in 53 years of IOSH that's never going to get out there and talk to the members of our great institution. And I got myself into a real funk about this for a few days and worried, lost sleep over thinking I'm going to be the most useless president. I can do nothing. And I felt anxious and fearfulness and all sorts of other mental ill health feelings over the last few months as I think about not just IOSH in the future, but the future of my business and my income and all of these things that have been affected, as for many other people too. So what strategies can we start to put in place to address the longer term impacts and further psychosocial risks that come inherently with the pandemic? We've talked about not just managing it as it happens, but the PTSD that may follow too.
We're about to, from a well-being perspective, embark on a program of education for our leaders and managers around pretty much exactly the kind of things you've been talking about, Andrew. What are the long-term effects of isolation? How to spot individuals who may be exhibiting signs that you're just not quite sure of that they are struggling. It might be that employee who's normally very quiet on calls who suddenly is very vociferous, and vice versa, and really educating leaders and managers. And then from an employee perspective, we focused on two measures. We have continually kept our message to, you are only expected to do what you can do. And whilst that might sound twee at the first level, if that's a reiterated message, which it has been right across our executive team and has been backed up with our actions, you know, nobody at Zurich has, for example, had to drop their hours. Nobody's had to change their pay. We haven't changed any contracts. If you can only work 30 out of your 35 hours, we're grateful for the 30 you can work. And then for me, the reiteration point is to try to encourage, and not HR-led, to try to encourage a dialogue. So we have a really good adoption of internal social media. We use Workplace by Facebook, and about 80% of our people are on, and about 55% are active every day, which is incredible. We've seen enormous numbers of people saying, I'm struggling today. What do you guys do? And watching our people just have the conversation amongst themselves, and then maybe we'll carefully drop in that people may like to watch this intervention, or they can get help here. But interestingly, it's not been HR led; it's been led by our people, for years.
I mean, on that point, and I saw something I think in one of the questions about vulnerability. I've been very open with IOSH staff that I've struggled. I'm an off the scale extrovert. I get my energy and my creativity and everything from being with people. I am sick of my own company, and Zoom just doesn't do it for me. I'm very tactile, I just need to be in a space with other human beings. And I've found it hard, and I've said that very openly at staff briefings, in my regular updates to people, because I think people haven't. I mean, that's my style anyway. But I think it is good that leaders show, vulnerability, and that actually they're struggling too. It gives people permission to say, do you know what? Yeah, I am. And if Biv is, it must be okay. I think, we've really got to, if anybody is, and I'm sure nobody is on this call, and certainly not on this panel, doing the stiff upper lip, it must all go on, it's all fine, is just like, that's just so outdated as a management, strategy. And I'm also not into the there, it's all going to be all right. It's about finding that middle ground of treating people like adults, providing the right support, signposting, so as Tim said earlier on in one of his responses, that we don't step into areas of professionalism, that is outside our boundary in terms of either HR, leadership, or health and safety. There are experts for some of the things that we're dealing with here. And actually acknowledging you have really bad days, you have really great days, and what small things can we do, as well as big interventions that we can do as an employer. Because as you said, Steve, it's been great to see people having virtual coffee mornings and doing all of that stuff. And I've tried to really encourage that, because, it isn't downtime, it's absolutely essential recharging time for people. But also not taking away from people the fact that they do have a personal responsibility around self-discipline for some of this stuff. That, I'm not going to tell people to switch off their laptop, You know, I'm going to tell them that it's okay to, and we don't expect you to. But, you know, you do also have to put the emphasis on people taking personal responsibility for managing some of their own, you know, work-life balance, you know. As I'm often saying, I'm not your mother, I'm your employer. But sometimes it's hard to strike that balance.
There's a couple of interesting comments here coming in. Donald Flannery says, sadly, we don't always know the depths of someone's depression until it's too late. And whilst this is a great discussion, we're thinking, aren't we, panel, about the people that are working. But as Donald points out, the whole event industry are out of work and a long way from any prospect of getting back to work. Businesses are gone. And Maria Wies is saying, yep, Donald, I concur with you. Sadly, we've had a suicide already by a furloughed colleague, and the effect on the whole workforce on top of the pandemic stress is devastating. Our managers were remaining in contact and the employees have free access to counselling, but it didn't work. So what else can we be doing? I think it's important, isn't it, to recognise that we're talking about a world of work, but there is actually a world of unwork or non-work that's happening at the same time as people are left with, well, nothing really. And that's causing lots of stress and pressure and depression, as Donald points out.
I think that's a great point, Andrew. I agree with everything that Steve and Bev have said. I firmly believe that there's still too much of a stigma around mental health. So I think until we change our language and behave differently, so what is the difference really between physical health and mental health? Shouldn't we just talk about health or just about well-being? And I think a lot of organisations have got a long way to go on that. And so I would include mine. And I think the longer the pandemic goes on, the more acute the challenges will be. And we've talked a lot about culture today. And I think we have to create cultures in all of our organisations where people can talk as openly as Bev has just done, because there are so many people who wouldn't be brave enough to have that conversation. And I think inclusion is a huge topical strategy that I think, you know, everybody is focused on diversity and inclusion. But if you ask anybody who has suffered from any kind of mental health issue, they will not feel included. And I think that's quite a difficult strategy to implement when we're all remote working. So I think there's lots to do. But I think there's lots that businesses can do together, and perhaps lots of areas where IOSH can work together with businesses to drive change.
So I'm going to hit pause for a second here. We've only got 5 minutes left. Time is rapidly racing away from us. We've managed to cover 30 questions that came in from the audience. I've still got 33 open questions. So we'll work behind the scenes after the webinar to try to get some advice and guidance on those and post them in the feedback that we share after the webinar. I've got 2 questions left on my screen, which I'm going to ask the panelists. Whilst you get ready to listen to those answers, you'll have found a poll pop up on your screen. So just 2 questions. If you could quickly just answer those, and then you'll be able to get rid of that pop-up if it's appeared. So panelists, here's the 2 questions. You've got 30 seconds each to answer both questions, 30 seconds total. Here they are. What would you not have done at the start of the pandemic crisis if you have the knowledge that you have now? And the second question, what's the biggest positive for you to have come from the crisis? So what would you not have done at the start of the crisis if you had then the knowledge that you have now? And what's been the biggest positive to come from the crisis for you? 30 seconds each. I'm going to set my watch running. Whoever's ready to start, please crack on. Go ahead, Steve.
So I would not have tried to have predict and put in communications a date for return to the office, which would be on the backside for weeks in the run-up to that date, which then sailed into the past. And I think the biggest has been, we always talk about our organisation being great in a crisis. Actually, it's not great in a crisis. It's a great organisation. Our people have done us incredibly proud, and we've learned a lot about each other through this pandemic.
Brilliant. Thanks, Steve. 29 seconds. Great standard. Who's next?
I'll go next, Andrew. So in terms of what would I not done, I racked my brains on this and couldn't come up with a single thing. So that's testament to the Crawford team. They did a great job. The biggest positives were 3 things for me. A huge focus on well-being, which I'm committed will stay. My company has shown innovation through the crisis, and I'm really proud of that. And also, I've seen the client partnerships that really matter the most have really come to the fore. So it's allowed us to deploy resource and investment on those partnerships that matter most.
Fantastic. Thanks, Lisa. Exactly 30 seconds to you. Nigel, how about you, sir?
I wouldn't have put so much faith in the governments around the world. Most of them, if they knew what they were doing. That was probably number one. That was a mistake. I think the biggest positive is for us, it's been the rise of digital. We've gone from, just say Spain, for example, digital consultations from 300 a day to 5,000 a day, for example. I mean, that's over a matter of weeks. So that's a big positive, and I think it's a big positive for humanity as well, because we can provide lower cost healthcare by doing it digitally. So I think that's going to be a good thing, and it's a sea change.
Fantastic. Thanks, Nigel. Tim.
The one thing I wouldn't have done is expect the advice and guidance on how to manage the virus would stay the same, which I did. And as professionals, I think I touched it before, we're used to certainty about managing hazards and risks. And boy, this has changed so quickly. So I would have been more open to that. And the positives just got to be the profession, and the recognition that the profession is getting through all of this just can't be beaten.
Yeah, I feel the same about that one. Thanks, Tim. It's a great time to be in the IOSH profession with such a wonderful opportunity that we have here, and a great time for us all as practitioners to step up and lead. So Bev, your final thoughts. What would you not have done at the start of the crisis, and what's the big positive for you?
Okay, so what I wouldn't have done is I wouldn't have renewed my car insurance, because my car didn't move for 6 months, and I would have taken home more personal items from my desk, because I thought I'd be going back in about a month's time, and I dread to think what are in my drawers. So those are the two things that I wouldn't have done. And the big positive for me is the transformation that we've made over the last 3.5 years in IOSH as an organisation has absolutely stood us in great stead in terms of the investment in technology to get into remote working seamlessly, and the culture that we've got. So the one IOSH approach, has just been amazing, and I'm really, really proud of what everybody's done for each other, for the team, and for the profession, because I think we have actually blown it out of the park.
Blown it out of the park, indeed. I think we could say the same about this fantastic panel today. It's pretty much 2:30 here in Switzerland, 1:30 there in the UK, which is the time that we're scheduled to end this discussion today. Those are all the questions that we have time for, even though there's still 34 coming in on Q&A. We'll try to handle all of those as best as we can and post them on the iosh.com/coronavirus web pages. A massive thank you from me to Lisa, to Steve, to Nigel, to Tim, and to Bev on our panel today, and to all of you out there for engaging. I counted 581 people on this webinar at one point, which is a tremendous number. Thanks for making time to share ideas, questions, and learn with us.